Now, researchers have found that children with coronavirus infection may display a very wide range of symptoms. People can request a test if they have a new continuous cough or fever or loss of taste or smell. But research by Queen's University Belfast found that diarrhoea and vomiting were more common symptoms in children with Covid-19. Our medical editor, Fergus Walsh, has the latest.
Education unlocked as more and more schools open their gates. Whilst coronavirus poses very little risk to children's health, it's important to avoid outbreaks spreading in schools. So this raises the question, how to spot the infection in the young. At present, you can get a coronavirus test if you display any of the following symptoms: a high temperature, a new continuous cough, or loss of taste or smell. Researchers, though, have found that in children, a huge variety of other symptoms may indicate a Covid-19 infection. These include headache, fatigue, sore throat, loss of appetite, skin rashes, diarrhoea, and vomiting. The trouble is, these can also apply to a whole range of other ailments. Researchers in Belfast believe the testing criteria for children need to be widened.
So based on the data that we found, I think that gastrointestinal symptoms of diarrhoea and vomiting in particular should be added to the testing strategy for children. I think we can reassure families that symptoms such as a sniffly nose, so sneezing or a blocked nose, it's not associated with Covid-19, and those children shouldn't need a test.
Hand hygiene, face masks and year group bubbles will help minimise the risk of coronavirus spreading. But if children are under the weather, what will parents do?
If my child didn't seem right at all, then I'd just keep him in and seek medical advice.
Take a temperature and then probably phone 111. In this current circumstances, I would certainly phone 111.
Around 4 million people are using the COVID Symptoms Tracker app from King's College London. The team say the signs of coronavirus infection are so varied in children, parents should err on the side of caution.
It's important for parents to, if their child is unwell, off their food, non-specific, keep them away from school until they start feeling better. That way, we're likely to cut down any potential infections, even if the risk is small.
Good morning.
The Department of Health says scientists advising them keep COVID symptoms under review. One thing experts agree on is that just a runny nose is not a reason to keep a child off school. Fergus Walsh, BBC News.